Hello, my name is Danielle Spada, and this is Case Study 2, where we will continue to focus on Client P. During this presentation, I will first review Client P. Next, I will discuss Client P's problem behaviors. With each problem behavior, I will share their operational definitions. For mouthing, I will discuss the intervention used to treat this problem behavior. I will also emphasize the functional relevance of the intervention used, as well as review the empirical evidence that supports the designated interventions used to decrease Client P's mouthing. Client P is a 4-year-old diagnosed with autism. He is vocal nonverbal. He's known to occasionally emit words, but cannot emit any words on command. He also engages in infrequent echoics. Client P attends a specialized preschool full-time and receives 40 hours of direct behavioral services per week. The Verbal Behavior Milestones Assessment and Placement Program was used for Client P because of its intended use for clients ages 0 to 7, for nonverbal or minimally verbal children, and for children able to engage in some structured assessment activities. The Functional Behavior Assessment was also used for Client P. This assessment was selected because of its intended use for clients with autism and for children with developmental delays. The problematic behaviors for Client P included elopement, tantruming, and mouthing. One of Client P's problematic behaviors was elopement. The operational definition of elopement is any instance of moving more than 5 feet away from the instructional area. Examples include walking away from the classroom table during story time and running away from a contrived play area. Non-examples included walking away from the instructional area to retrieve the communication book, as well as running away from the instructional area to retrieve a designated chewing item. The perceived function was escape. Client P also struggles with tantruming. The operational definition of tantruming is engaging in any one or combination of yelling, crying, and dropping to the floor for any duration of time. Examples include yelling after opening the lunchbox, crying while sitting alone, or dropping to the floor when being shown the first then board. Non-examples include yelling after experiencing fear, crying after injury, or dropping to the floor after tripping or being knocked over. The perceived functions were both attention and escape. Another one of Client P's problematic behaviors was mouthing. The operational definition of mouthing is any instance of placing objects in the mouth that are not intended for chewing or biting. Examples include biting toys, licking the floor, and biting clothes. Non-examples included biting on a chewy, eating food, or drinking from a straw. The perceived functions from the FBA was automatic reinforcement, or sensory. The intervention utilized to decrease mouthing was response interruption and redirection. The intervention procedure was that if Client P started to engage in inappropriate mouthing, he was to be immediately redirected to use his designated chewing item, which we refer to as a chewy. Social praise was then used to reinforce the use of the chewy. Now, regarding functional relevance, the perceived function of Client P's mouthing was automatic reinforcement or sensory. The replacement behavior was chewing on designated chewing items. The replacement behavior satisfied Client P's sensory seeking. In other words, the replacement behavior function appropriately matched the problem behavior function. Client P was taught to achieve automatic reinforcement in a more socially appropriate way. Response interruption and redirection was an evidence-based intervention for Client P. Caldwell and Jones in 2020 found the intervention to be successful for children with developmental disabilities. Simmons and Kaufman in 2018 found the intervention to be successful for children with autism. And Davis and Reeve in 2019 found the intervention to be successful in the classroom setting. In conclusion, Client P's problem behaviors included elopement, tantruming, and mouthing. Response interruption and redirection was used to decrease client P's inappropriate mouthing behavior. Response interruption and redirection has functional relevance for inappropriate mouthing. Also, response interruption and redirection was an evidence-based intervention for client P. Thank you for watching.